If you've ever felt that sharp, sudden twinge when you squat down to tie your shoes, or that deep, persistent ache when you're just trying to climb the stairs, you know firsthand how chronic knee pain can completely hijack your daily life. It's exhausting, and when conservative treatments like icing, stretching, and physical therapy just stop giving you relief, well, the prospect of a major joint replacement surgery can feel incredibly daunting. But there's a middle ground that's gaining massive traction right now. Welcome to today's Explainer. I'm thrilled to guide you through this pragmatic, no-nonsense look at stem cell therapy for knees. Today, we're going to separate the regenerative hype from the hard clinical reality. We're looking closely at the data, the biology, and exactly what you can expect.
Okay, let's dive into this. Today we'll be covering understanding stem cell therapy, the sources of stem cells, the 5-step procedure, are you a good candidate, and finally, results, costs, and surgery.
Section 1. Understanding stem cell therapy.
Now, what's really interesting about this is that over the past decade, this field has moved way past the purely experimental research phase and straight into mainstream orthopedic clinics. Right now, there are actually over 600 clinics offering knee stem cell therapy, and patient interest is literally skyrocketing. But to understand why it's so popular, we really need to understand the biology. The specific clinical term for the cells doing the actual heavy lifting in these therapies is mesenchymal stem cells, or MSCs for short. These are incredibly potent regenerative cells naturally found in bone marrow, fat, and umbilical cord tissue. When an orthopedic specialist introduces them into a damaged knee joint, their primary job is to actively support tissue repair and aggressively reduce inflammation.
You see, these cells are not just biological painkillers masking your symptoms. Not at all. Once inside the joint, MSCs release powerful growth factors that specifically target cartilage repair. They actively block and reduce the inflammatory signals that are causing your pain and swelling in the first place. Furthermore, they act kind of like biological managers, supporting your surrounding native repair cells to work harder. And remarkably, in the right environment, they can potentially even differentiate into chondrocytes. Those are the specific cells that actually form cartilage.
Section 2. The sources of stem cells.
So a question I always hear is, where exactly do these incredible healing cells come from before they get put into my knee? Well, let's break down the clinical options, because there are 3 primary sources utilized in clinical settings today. First up is bone marrow aspirate concentrate, or BMAC. This is drawn directly from your own pelvis using a needle. Because these cells come from your own body, the risk of rejection is practically non-existent, making it one of the most widely studied approaches. Second, we have adipose-derived stem cells, collected from your abdominal fat through a mini liposuction. Fat tissue is actually rich in highly concentrated stem cells, and recent data shows excellent efficacy, though it can sometimes be a slightly costlier procedure. Third is umbilical cord tissue. This is an allogenic source, meaning it comes from a pre-harvested donor, not you. It boasts strong anti-inflammatory properties and completely saves you from having to undergo a harvesting extraction, though I should note, long-term data is still developing compared to bone marrow.
Section 3. The 5-step procedure.
Now, the idea of extracting and injecting cells can sound intimidating, right? Maybe even like it requires a massive, multi-day hospital stay. But I really want to reassure you and take the mystery out of this. This is a highly standardized, same-day outpatient process. Let's walk through your chronological journey on treatment day. Step 1 is your consultation and assessment, where your doctor reviews your history and looks at X-rays or MRIs. Step 2 is cell harvesting, where your doctor collects the raw material from your bone marrow or fat. Step 3 is processing. The harvested material goes straight into a centrifuge to highly concentrate those MSCs we talked about earlier. Step 4 is the injection, and this is vital. The actual injection only takes about an hour, and specialists use real-time ultrasound guidance to ensure absolute pinpoint accuracy when placing the cells into the damaged joint space. Finally, Step 5 is recovery. You're discharged that very same day, typically returning to light daily activities within just a week.
Section 4. Are you a good candidate? So the crucial point is this: we absolutely have to practice pragmatic realism here. As amazing as regenerative medicine is, this therapy is not a magic cure-all for every single type of knee pain. Patient selection is literally everything. Good candidates generally have mild to moderate osteoarthritis, meaning they still have some remaining healthy tissue in the joint, and they're typically active individuals who are trying to avoid surgery. On the flip side, poor candidates are those with severe, end-stage, bone-on-bone osteoarthritis. Let me be totally transparent with you. If your cartilage is completely worn away to the point where a bone is literally grinding on bone, the stem cells simply lack the structural scaffolding and raw material they need to do their repair work. In those severe cases, alternative surgical approaches are usually necessary.
But if you are an appropriate candidate with mild to moderate damage, the numbers are highly encouraging.
A 2025 systematic review and meta-analysis actually found a success rate right in this 60 to 85% bracket for appropriately selected patients. Now keep in mind, success in this context doesn't mean giving a 60-year-old and 18-year-old me. It means achieving significantly reduced pain scores, heavily improved physical function, and a much, much better day-to-day quality of life.
Section 5. Results, Costs, and Surgery. It's time to focus on the logistical, financial, and comparative realities you really need to weigh before making a decision. Let's tackle one of the most frequently asked questions head-on. Can stem cell therapy delay a knee replacement? The short answer is absolutely yes. It's vital to understand that stem cell therapy does not structurally replace the joint like a metal implant does. However, by deeply reducing inflammation and improving joint function, it can significantly buy time and delay the need for that major surgical route for the right candidates.
And this brilliantly illustrates the stark differences between the two approaches. Looking at invasiveness, stem cell therapy is a minimally invasive, same-day injection, whereas a joint replacement is a major surgical procedure requiring anesthesia. The recovery for stem cells is days to weeks, compared to months of pretty grueling rehabilitation for a replacement. As we noted, stem cells are best for mild to moderate osteoarthritis, while replacements are reserved for severe end-stage disease. And a huge differentiating factor you have to consider is the financial side. Stem cell therapy is typically not covered by insurance, while a total knee replacement usually is.
So let's ground this firmly in financial reality. The realistic out-of-pocket cost for stem cell knee therapy generally falls between $7,000 and $10,000 per knee. Because this treatment is not FDA approved as a standalone therapy for knee osteoarthritis, major insurers, including Medicare, largely classify it as experimental. That means you're looking at a direct, out-of-pocket investment for this regenerative approach.
Finally, you need to manage your timeline expectations. Look, this is not a cortisone shot that just numbs the joint by the time you reach the parking lot. This is a gradual biological repair process that requires real patience. Meaningful relief builds over 4 to 12 weeks as the tissue repair unfolds, and that relief typically lasts between 1 to 3+ years. Some patients do opt for a second injection down the line if symptoms start to return, but combining this therapy with physical therapy and weight management can really extend those benefits.
So we arrive at the ultimate question. Is regenerative medicine the right next step for your knees? We've covered the fascinating cellular science, we've demystified the same-day procedure, outlined the financial realities, and defined exactly who makes a good candidate. If you're dealing with mild to moderate osteoarthritis and you're looking to delay a major surgery, consulting with a qualified orthopedic specialist is your next logical move. The science is here, the protocols are standardized, and the choice is yours. Are you ready to see if your body's own biological architects can help you reclaim your mobility?